And joining me to discuss this is a public health physician, Yinka Adeniran. Good to have you join us, Dr. Yinka Adeniran. Now, what do you make of this latest development where the Presidential Task Force is saying they're recording a high level of infection rates amongst health workers?
Okay, thank you so much for having me. I mean, it's quite worrisome that we are still having, cases among health workers. Now, it's not just to worry about it. It's not just to start raising an alarm, but the question is, what are we doing about it? Now, the minister said that they are training and they are retraining, and then they have PPEs and so on and so forth. Yes, these things are good, but they are not enough. Okay, so when we are talking about hazard in the workplace, I mean, the best thing is to eliminate the hazard. Okay, so but we have a virus that we have to live with, so we can't eliminate that. I mean, we are still trying to control that now. So, but there are other measures that we need to put in place. We have to look at the work environment. Now, why are we having these cases among healthcare workers? It's not just about training and retraining. I mean, that's very, very good. That should be part of our strategy. PPEs also should be part of our strategy. I mean, that's the last line of defense. But there are other strategies that we have to look at. Okay, number one, we can look at the work environment itself. I mean, if you go to so many of these facilities, they are not quite conducive for the crowd. I mean, when we talk about controlling COVID, we talk about crowd control. I mean, you have to avoid crowded areas. And then you also have to look at the setting where you are seeing patients. Most of these places are not well ventilated. Sometimes you have a consulting room where you have 2 or 3 doctors managing and trying to see patients. I mean, while you are still trying to say, okay, let's control the people that are coming to the facilities and so on and so forth. So there are a lot of factors that we have to consider. So it's not just, I mean, we have to look at our work.
If I may just jump in there. Some time ago, the PTF also mentioned fatigue amongst health workers. Now, we're hearing about high infection rates amongst health workers as well. So with these two factors or indices, how detrimental is this for the efforts to curb the spread of the virus?
Yeah, of course, it's if we are not able to address the issues at the healthcare facilities, talking about the healthcare workers. I mean, by the time you have a lot of healthcare workers having this infection, one, they have to go on self-isolation. That means you are not having enough hands in the facilities to attend to patients. And then if you also have to, I mean, if we lose them to this virus, that means we are short 1, short 2, and so on and so forth. So it's quite important for us to look at things holistically. So training is good. PPEs are good. Let's look at the work environment. Let's look at the facility. Let's look at the where these people are seeing the patients and a whole lot of other things.
We've been dealing with this virus in the country for about 5 months now. What kind of respite do you think should be given to these health workers? As we imagine that they must be really tired by now.
Of course, there are, I mean, a lot of pressure on the healthcare force, healthcare workers. A lot of pressure, I can tell you that, because I'm also part of the team, and then we have to battle with quite a whole lot of things. Now, I've said this before, that it's not just about training and the rest. We also have to look at their welfare. We have to look at, I mean, recently we had a group of health workers trying to go on strike. I mean, that should not be heard of at this point. So a lot of them are not being paid as at when due. I mean, I don't have all the information about. I know that recently there were agitations among health workers that they were not paid their hazard allowance and so on and so forth. So those are areas that the government also has to look at. Okay? Yeah.
All right. Dr. Yinka Adeniran, thanks for talking to us.
You're welcome.